Hello friends, Dr. Mitnaul, your friendly neighborhood child and adolescent psychiatrist. So this video is going to be a little bit different than the things that I've done in the past. So this has more of an academic flavor, but I do think it also holds a lot of really practical information. So thankfully I was invited about a month ago to give a talk to the University of Mississippi Medical Center group on women in medicine and science. And Dr. Cornelius and the really wonderful people there really laid out the virtual red carpet, and I was able to talk to them for about 45 minutes or so about this really important topic of burnout, understanding what it is, because you've probably read and heard a lot about it in the news. And then my goal for the talk was to help the people that were listening recognize in themselves some of the features of burnout and how they can identify it and start to root it out or start to treat it or recognize the areas in their life that might be frayed by our time and by the pressures of our modern age, but also to recognize it in those that they work with those that are around them, with some of their peers, to give them resources. So what can you get out of this talk? I think that you're gonna get some really good tools, if nothing else, some free resources to do a self-evaluation to see where you might be in terms of burnout and your work-life balance. And hopefully from these evaluations you can get some really good tips too for how to improve those areas of your life that you feel like are lacking, where you need a little bit more. So one other thing to know is that this recording, we didn't get the first few minutes, and that's why I'm giving you the intro to understand the focus of where we're going in this talk. So hopefully it's helpful for you, whether you're a student, a parent, a young person, an older person, just looking to kind of shore up your resolve and resilience. Take good care, my friends. I appreciate you watching, and be well. And don't forget, before we get to the talk, to burn that subscribe button. Again, that helps us to reach more families, and that's the kind of burnout that, I'm okay. I'm okay if you're dealing with that. I mean, that helps us, helps me, help you, help me. But do that, and without further ado, let's get to it.
And so what is it that our organizations and our chairmans and department heads and colleagues, what is the not so subtle hint that they're sending us across our email or across the flyers on campus? Well, I think that underlying message really is, how do we find a little more peace, right? And how do we relax a little bit more? And how do we help each other and ourselves to not be wound so tight? So, certainly if we're not immune to all the things going on in society and the work both within our respective fields and outside of it, our trainees certainly aren't either. And so I'm going to offer you some reflection and data to encourage the following three things to help you in supporting the mental health of your trainees. Now, the first of these is actually going to be self-care. So we're going to talk a little bit about that. So I know some of you tuned in because you're really just looking for nuggets for just your trainees, but it turns out that it's hard to give what we don't have. And so certainly when our tank is dry or empty, we're not being a model for those who look up to us in various capacities, but it also drains our reserve to be able to help pour into them and help their development and helping recognize what they're facing. And so we'll spend some time talking about that. The second part that I hope that you walk away with is also being able to see the signs. So, I think it was Smokey Bear who used to remind us, where there's smoke, there's fire. And only you can prevent it, right? And that's if we're kind of cognizant of what to look for, what might be the signs that someone's really hurting, or just experiencing some trouble that we might be able to at least be a resource for and help them plug into appropriate resources. And then thirdly, of course, kind of the resources to help put out the blaze if people are starting to feel burnout, especially in our trainees. All right, so perhaps you're like me, and when you first started thinking about this topic of burnout, you're probably thinking, okay, I have all of these elevated pressures, both in terms of administratively, in terms of publications, and in terms of funding, in terms of family demands. you know, it's hard sometimes to kind of peel back the layers to think about how could a trainee be, be really burnt out in their phase of life. So I think I was talking a little bit about, about thinking about the trainee and thinking about how they might be struggling, and what's so different about this time that I think is added a little bit more pressure to what they're doing or seeing, or trying to navigate. And so I, in preparing this talk, I spent a little bit of time just kind of reflecting on my own experience in medical school. So as Dr. Cornelius mentioned, that my wife and I, we have 5 kids, and actually the first of those came at the beginning of medical school for me. So as a non-traditional student, meaning that I'd done some of the work and a little bit of graduate school before having started my residency and going to medical school. And so, there were some of the roles that I had were in the oncology lab and doing diabetes research. And so I had to remember my wife being pregnant at that time with our first child. So I'm wrapping up, one course of study to move to Texas to begin another. And at the same time, we're attempting to buy our first home. And at the time, we were moving from Washington, D.C. to San Antonio. And so, I mean, when you put those, when I think back on that really crazy time, and why would I have chosen to do so many firsts in my life with both the significant move and a house and a child? I can't imagine what it would have felt like to add a pandemic to that equation and to make it out sane and safe to be with you all. Next slide, please. So let's go beyond, just my own personal story. So I'm going to ask you to do a little bit of mental participation with me. Now, thankfully, you won't have to kind of chime in, but really this is just for you to kind of reflect on. So, imagine being a younger trainee or a young trainee, at least younger than you are right now. And perhaps you're in a new place. Perhaps you have a limited community of people that you're connected to or familiar with. And maybe just kind of little familiarity with the landscape and some of the, services and terminology and things like that, right? And so in the midst of that transition, imagine kind of limitations too on when you're not engaged in your primary work, finding a way to make space to have that release valve to go, visit family or go visit friends or jump on a plane and do some of those things. And imagine those things being a little bit limited. Or imagine in that same space having the cancellation of those normal kind of moments that are guideposts along the way, rites of passage for family members. So maybe missing a baptism or a wedding or a bar mitzvah or some or one of these kind of seminal events. And so in our lives, I would argue these aren't just milestones that bring closure of one thing and kind of entree to the next. That we look forward to, but these are actually also opportunities for us in the world to push pause on our life, right? When I'm, at my cousin's wedding, kind of celebrating, their nuptials, that brings for me, right, an opportunity to reflect on my development, reflect on, maybe my own marriage if I'm married, reflecting on the people that have helped support me, to that point as well. And so in our busy lives, and certainly in the lives of our trainees are selected among a group of their peers for being, productive, for being prodigious, for being, timely, for being organized, all of those things. And so often in that rhythm of life, it's hard to really make that time to hit pause. And so I want to argue that, with one of the things that our new trainees may be struggling with too is just that those times, those normal parts of life where you'd be able to push pause, be able to sit down and reflect, and spend some time thinking about the things that really drive us, that motivate us, that speak to our hearts, that there can often be less opportunity to engage in those things. Next slide, please. So part of the burnout, image is that I like to think of is something being set aflame. And we like things that are set aflame. So, very young children, unfortunately, like it a little bit too much at times. And I'm speaking from experience. I think just recently, my daughter almost knocked over a candle in our living room. Thankfully, she was being supervised at this moment. But fire actually, has a lot of symbolism actually. And so when we think of things that are set aflame or set afire, whether it's someone's inner passion and we're using it, poetically, or if we're looking at, a sporting event like the Olympics, where, really the call of the games is brought to its peak at the beginning by a physical, tangible kind of setting a flame to something, and I think that represents for us kind of the heights of human achievement. Okay, so what's wrong? What can be wrong with that? Well, the only thing, the thing wrong about the world in general can be, that are not just bad things, but good things that are done kind of excessively. So think overeating, oversleeping, over texting, whatever that is. So next slide, please. So what is burnout, and how does this tie together with our theme and thinking about how to help our trainees? So next slide, please, if you could. Thanks. So what is burnout? So burnout is a long-term kind of stress reaction that's really part of the features are emotional exhaustion, what is sometimes referred to as depersonalization, where people don't feel like they're really inhabiting their world, inhabiting their space, that things aren't real, that it's almost kind of, dreamlike in a way. And a really diminished or shortened sense of personal accomplishment in their lives. So I think those are kind of the three hallmarks that typically, in many of the definitions that you'll see in the literature, will describe kind of those three things. So and so we'll keep revisiting those themes as we go along. So think again, emotional exhaustion, depersonalization, and a shortened sense of someone's own feelings of self accomplishment. Next slide, please. There's a group, Smith and Hambelton in 2013, which I'll rely on their work quite a bit actually during this talk, have described what's called a burnout triad. And so this kind of fleshes out those three main categories. So when I mentioned the emotional exhaustion, depersonalization, you might have been thinking, so, tell me a little bit more about what that might look like. So, emotional exhaustion can refer to, fatigue over things, over just getting up in the morning, maybe feeling kind of emotionally drained from work, maybe perceiving work with others all day as a drain, or as a something that brings about kind of a mental block. Maybe perceiving working with others as something that they don't want to engage in. Or again, the depersonalization, so feeling dehumanized in someone's work with others, feeling more callous maybe about things that happen. So the thing that spilled, the data that didn't get collected, having kind of a I couldn't care less attitude may also be part of the burnout triad that we see. Negative or kind of cynical attitudes towards work, towards patients, towards other colleagues too, can be part of this depersonalization. So as you can see, it's kind of where the person is feeling less emotionally attached, or at least showing signs of being less attached to their environment. And then again, in the decreased sense of personal accomplishment, again, I think that kind of speaks for itself. So here are some of the some of the clues that we might look for within ourselves, and certainly our trainees too, that are a little bit more tangible too, that help to illustrate this a little bit more. Next slide, please. So another way to look at it is physically, emotionally, and behaviorally. So physically, what might you see? So people, again, feeling tired, feeling drained most of the time, which actually can have impact on kind of lower immunity, feelings of being sick a lot. So a lot of somatic and bodily concern, frequent headaches, maybe back pain all the time. That's that's out of proportion to what you'd expect, or muscle aches. Changes in appetite, or changes in sleeping habits. So those are some of the physical signs that you might notice among some of your trainees who came in kind of spry, eager, ready to work. The next slide, please. And so what can the emotional side of the burnout look like? Well, if you're hearing in the language that someone uses, so that this kind of imminent sense of failure and foreboding, maybe you're hearing a lot of self-doubt. So every time they're given a task or something to accomplish, you hear them kind of second guessing themselves, and not in a conscientious, reassuring way, but in a way that is starting to really give you the sense that they're beating themselves up inside, and they really have a lack of their own kind of self-worth or self competence. Maybe feelings of trapped or feeling defeated. Sometimes actually it can come out as boredom too, and irritability. There are other signs to look for too that can be signals of emotional distress, so detachment, feeling alone in the world, loss of motivation. And again, some of the things that we mentioned before about increasing cynicism, negative outlook, and lack of self-accomplishment. And next slide, please. And then behaviorally, so and sometimes actually these are the most evident things. Often, especially in our trainees, there might not be a lot that they say to us. Maybe they're performing well or keeping it kind of locked in the same way that we often don't show the world all of the layers of emotion that we're kind of carrying along with us throughout the day. And so some of these can be a little bit both more subtle, but actually may be the primary way in which someone is voicing that they're really feeling burnt out, and that's by their behavior. So looking withdrawn, maybe withdrawing from some of their responsibilities. Procrastination. So if someone who was previously pretty, dutiful, that you're seeing that, it's taking longer and longer for the same things to be kind of accomplished. And also in terms of habits. And so this would require maybe a little bit more intimacy than a professional setting might provide, but turning to food or drugs or alcohol in order to cope. Maybe taking out their frustrations on other people, or skipping work, or coming in late, or leaving a lot earlier, right? So all of these may be some of the behavioral things that are letting us know that someone is struggling, or someone near us is struggling. And so this undoubtedly affects how we see the world, and we know that the brain can sometimes start to anticipate the negative. Next slide, please. And so, burnout. And so actually before I go on, so I thought this was both funny and interesting. So as I mentioned about sometimes the brain being in a funk or feeling in a burnout can start to look at the world and assume the worst when they see data put before them. So I just wanted to give you a second to take a look at this really neat image. So all of these plates are flipped upside down except one. But once you see that one, they'll all be right side up. So for me, I don't, and again, I'm not going to have you chime in. I'll be interested at the end of your perspectives on the drawing. But for me, it was the lower left. So I saw the lower left cup or bowl seemed open to me, and then it seemed to transform kind of my vision of the world. And I think in its own silly way, it's kind of an illustration of when people are feeling or working or laboring under this cloud of heaviness. That it really can influence their expectations and the way they see the world, even if objectively there's something else to behold. All right, next slide, please. So we know a couple of things about burnout, and then I'll get to this slide actually. That burnout has short-term and long-term effects. So it's estimated that there are billions of dollars in productivity, errors on the job for physicians. Malpractice tends to be higher among physicians who identify themselves as dealing with burnout, decreased staff satisfaction, hostile work environments, early retirement, all of these things. And then we know that we know from the literature too that just increased stress also makes for poorer health outcomes too. And so that's obesity and heart disease and substance use as well. And so there can be several contributors to this. A recent study from the Mayo Clinic pointed out a couple of things. So lack of control, unclear job expectations, if there's a dysfunctional workplace, also mismatch in values. So if the values of the person kind of working or undergoing a task differ greatly from that of the employer or the business. And also how grievances are handled as well. And so, and so let's now turn our attention to, what are some of the ways that we can measure this? So I've talked about some of the ways that you can observe it, and maybe the things that at least would highlight for you that someone near me is struggling. The good thing is that there are really great ways to kind of measure it. Some of you may have seen some of these if you've done kind of retreats, although I guess people aren't doing many retreats these days. So maybe this will be my encouragement to do kind of an individual retreat and an inventory for yourself. But here are some of the most common ones that I often refer to for helping people to identify where their burnout points might be. So there's the POISE Wellbeing Self-Assessment Scale. It has about, I think, 16 to 18 questions. It's pretty easy to do. There, and they have you complete it on kind of a Likert scale of 1 to 5, where you get to rate kind of where you fall in terms of several different categories of wellness. The Maslow burnout inventory is probably one of the gold standards. Certainly, most research around this area will often use this inventory. There are 22 questions, and they focus on actually some of those areas that we talked about. So the emotional exhaustion, the depersonalization, the feelings of personal accomplishment, and efficacy. So those things are kind of tallied together, and it gives you some interesting info to kind of take and use. There's the Oldenburg burnout scale, which is a 16-item scale. And then probably one of my favorites, just because I'm cheap and it's free, is the Copenhagen burnout inventory that looks at, that really compiles things into 3 categories. So work-related, client or professional related, and person or kind of your intimate, environment and attachment and kind of family system, to give you a very practical tool for how we measure burnout. And so with a trainee who might be, feeling a little bit down, or for whom you suspect, this might be a helpful exercise for them to do, not necessarily that they need to, reveal it to you, but maybe for their own sense of inventory, to learn where the rough patches are, and to maybe start to give themselves some ideas too about where to go next. Next slide, please. All right, and so I'll give you just a little bit of statistics that that stress levels, along with that stress levels are up, along with that they're paired with kind of burnout, depression, and suicidality. And so for the worker in general, and this is in every field, not necessarily just kind of medicine or medical fields. The reports of burnout are something like 25%. Between 40 and 78% of physicians, depending on the reports that you're looking at, report some degree of burnout in the work that they do. 16% of those in these same surveys mentioned and met criteria for depression, actually. And so again, in terms of burnout, can be kind of the early sign of recognizing someone's struggle that might lead to an actual clinical diagnosis of depression too. And so guarding against that and looking for ways to support it are really important. And so some of you may already know this, but unfortunately, the burnout rate in physicians struggling with depression has actually been raising, and I think also during this really intense time where we're doing really hard work on the front lines and really extending ourselves, that's been increasing too. I think the last numbers that I saw, something were between 250 and 400 suicides of physicians occur a year, and I mean, and that's the equivalent of 6 to 7 kind of med school graduating classes. So again, it's really important for, I think, our culture and time to be really focused on how do we help to promote resilience. So let's get to the resilience part. So the process of coping well is how I would define resilience and how it's often defined. So, and that's coping well in the face of an adversity, and it doesn't matter what that adversity is. So trauma or tragedy, or just plain old, stress of what we do from day to day. And so I like to think of resilience as, our ability to kind of bounce back from the hard things of life. And so here's where, I didn't include any music, but this is where I'd cue the old school Chumbawamba song from the early 2000s about getting knocked down, but getting up again. Because I think, that in many ways kind of encapsulates what resilience really means. Next slide, please. And so we tend to kind of think about, there are internal motivations and external motivations, and maybe this will be part of kind of our future discussion if people have other particular questions about this part in general. But, we know that there are some things that help people to feel competent, help them to feel whole, and tend to keep them on track. And so there's a recent New England Journal article by Hartsband and Groupman that identified some of these three, which I think I agree with, because I see them quite often among both colleagues and the people that I treat. So three of the pillars for kind of intrinsic motivation. So that motivation that just comes deep from inside, the motivation that you probably wrote about in the essay to get into, graduate school, medical school, probably included some of these ingredients. So one, deep knowledge, so that kind of thirst for knowing more. Relatedness is the other pillar, so meaning attachment to one's community, environment, colleagues, to patients. Are among them, and autonomy. So the ability to feel like you have some control in affecting the things in your world. And then there are external, motivators, which we're all aware of because we use these all the time with our kids. Clean your room and you can play Xbox for 10 minutes, or or finish taking out the trash and then you can have some ice cream, or whatever that is. And so sometimes, in terms of an organizational standpoint, it can be helpful to think about, what have we set up as our internal and external motivators for people, for ourselves, and for the trainees that see us. All right, so let's get to the interventions part about what can we do to help ourselves and our trainees. Well, it's really quite simple. If I think the best and easiest formulation that I've heard is, really resilience and helping people to thrive comes down to decreasing the negatives and increasing the positives, right? If only life were that simple to just, put it on that scale. But by and large, that is the work that we're doing, and so we're going to break it down into areas. So looking at education. So through the measures that I kind of mentioned before, I think those are helpful kind of inventories for not only our personal use, but for our trainees too, because people may not identify really what is going on for them. And so you've probably had this conversation too, and so I'll give you kind of a short vignette. I had an associate, a friend who got married like just pre-COVID. I mean, they just made it, so they actually got a church full of people and the ability to celebrate. And so I'm talking to the bride and asking about worry and anxiety, and I promise I wasn't trying to be her therapist or psychiatrist. It just comes out of you. So are you feeling a little bit nervous? And so her response was, well, no, I'm not feeling nervous in the least. Actually, I'm feeling fine. So of course, I can't leave well enough alone. So, how's your sleep? Well, actually, that's been a little crummy. Well, what's your appetite like? I really have not been able to eat at all. So it was funny because, cognitively, I think she was being honest with me when she said, no, I'm really not feeling stressed whatsoever. But as we start breaking down what are the parts of your body that reveal the hidden stress that maybe you're not overtly expressing, it became clear, what, I am feeling a little bit anxious, and maybe, here are some things that I need to do for myself when I'm feeling anxious. And so we can't downplay the education part. And that's, I think, why the inventory are so helpful, because I think these often help you to mine areas that maybe aren't top of the mind for people who are going through and struggling day to day. But it can be helpful in just feeling empowered that, oh, I can see where my tank isn't full, and maybe I need to feed that area of my life. Um, the second thing, so identifying triggers. And so that may be more related to kind of counseling or support, but if your trainees are close enough that they can tell you or do share with you some of the past experiences that they've had that have led to negative outcomes. Again, sometimes we're not recording those things or kind of conscious of those things as we're going through, but making people aware of them or helping them to be aware of them can be a helpful coping strategy. Again, just by raising their awareness and giving them another chance to appraise the situation and think about how they might attack it. Next, so introducing healthy coping actions. And again, I think it's so interesting how often I might have someone do one of these inventories, and really the healthy coping strategies kind of tumbles right out of it. I mean, once you ask someone, how much time they're making for themselves in terms of their physical well-being. So, maybe they had been actively engaged in the practice of yoga or meditation or mindfulness, and they're just asked about it. Well, if the answer is no, and this hasn't been a priority, or I've let some other things kind of swallow that up, often the answers for healthy coping kind of fall right out of kind of doing the exercise itself. And then the last part is perhaps more psychotherapeutic, but dealing with your feelings about the feelings. And so what do I mean here? So, there's often kind of a feelings trap that we can get locked in, and certainly our trainees aren't immune to it as well, where we feel bad for feeling bad, that you start counting up the things that are going so well in your life and wondering, well, then, I should discount my feelings of, frustration or feeling more tired or procrastination, or, I'm going to chalk those up to just, plain old laziness. And so that thinking about thinking, going another level deeper can often be helpful too, and helping someone to kind of persevere and move through to the resilient side of the equation. All right, next slide, please. All right, so just some more ideas for things that people can do, and maybe some things that you've thought of yourself. But often, in terms of self-care, I'm encouraging exercise and sleep hygiene, nutrition, people getting medical care. So I know that I'm preaching to the choir, but physicians, we are awful at seeking our own care, even if we're engaged every day in the provision of care, and maybe tutting someone else who hasn't been better attuned to what's going on in their life or in their as it pertains to their health. So working on relaxation techniques, maybe working on some deep breathing, maybe the morning prayer that you used to be engaged in, kind of bringing that back into focus to help to center your day. Journaling, writing stress diaries, getting re-engaged in something that you're passionate about, but that has fallen to the wayside, even if you're only able to do 5 to 10 minutes of playing on that keyboard or playing on the drums. So also, so in terms of the recovery mode too, so avoiding the unhealthy and unhelpful actions. And so again, that's different than just recognizing, here's a practice that I've fallen away from, but often we get into maladaptive habits, and I've kind of referenced those before, whether they be, substances or piling onto the work with no real operational plan about how to incorporate the things that nourish our souls in the deepest part of ourselves. And then also kind of our social interventions with good attachments. I mean, they're just really, really important. And so it's been hard, certainly from the mental health side of the house too, that we haven't actually done as great of a job as I wish we would as mental health providers too, to keep reiterating that even in a time of geographic distance and social distance for to decrease our risk of COVID, that we really don't want this type of social distancing that makes us emotionally distant from the other people around us too. And so finding some ways to have those reconnecting moments with our colleagues, with our family, are going to be really crucial to the next stage. Next slide, please. And so, I think there's really good data, and this is from a paper in 2015 about there being a linear relationship between how empathic, engaged, and involved leaders are with their staff and burnout rates. And so, I mean, the fact that actually that you're here, that you're listening to me, that you're thinking and problem solving with ideas for being a better you, to make you better able to respond and recognize what those around you might be struggling with. You're already engaged in that work, so kudos to you for doing that. And so again, some of you might struggle with a little bit of nag in the back of your mind that's telling you, don't take that extra 10-minute breathing break, or hanging out among the stars. You still have more notes to write, or you still have another proposal to get in. But that selfish time that you spend for you, again, think of it as an investment in your ability to be a great leader where you are. Next slide, please. And so really that's I guess I'll end there, because I could talk all day, and I think it's actually going to probably be more helpful for me to field and entertain your questions, and also thoughts too about this, about burnout, and about building resilience in ourselves and in our community. So anyway, thanks for listening, everyone.
Thank you so much, Dr. Mitnaul, for that great presentation. If anyone has any questions, please feel free to post them in the chat. We do have one question that was asked by Dr. Hannah Broom. Are any of the reputable burnout surveys that you mentioned available for free online?
They are. So the Oldenburg is my favorite of them, and it's for that reason. It's the Copenhagen burnout inventory. So that one is available online for free, and is really easy to use. So that's in all honesty, that's my go-to. Great question.
We have a couple of people typing. I'm just waiting to see what they're putting.
Oh, great.
So while they're typing, I do have one question. You mentioned about, I know that the beginning of the talk was about taking care of yourself as a leader. And at the end, you talked about not thinking of taking that personal time as being selfish, but helping you to be a great leader. Do you think that also being able, or taking that time as a leader, also serves as a good example to the people that you are leading, that it's okay for them to take the time to take care of themselves as well? Because
it is
that if they see you're always at work and you're always then they feel like, well, I can't really show how I'm really feeling, because then I'm gonna be perceived as not wanting to work hard or not being as good at what I do.
Yes, that is a really great point, and I think modeling is so important. And again, I think we tend to think about it more with our kids, or with that I gotta demonstrate this really great behavior so they know that I mean it, not just in my words, but in the way that I live my life. And so it's so meaningful and impactful, I think, if our trainees kind of see that, hey, this is the time that I spend for myself, or, I treat, this Thursday afternoon at 3:00, is just as significant as a patient encounter. So I don't care what's going on, I'm going to drop it and be there for that, because I've made that a priority for my life, and it's part of what feeds me. It's part of what sustains my ability to do it long term, because I think that's one of those less spoken about leadership characteristics, I think, that we want new trainees to get, that it's not just do, and then you get to die with happiness and satisfaction, but also I think the things that help sustain us, that keep us in the fight longer, that help us to do the really hard work is that when you go home, you have that family support, or the support of your spouse, because you've had enough time to also kind of nourish that, and that in turn helps you to be kind of a better person. So I think your example is absolutely right. And not to put you on the spot, Dr. Cornelius, but I think when we were talking before, about how open you've been with, with folks in your lab, and just, let me know, give me a call. If you need a break, or, you can come sit, here in my office, or, I think that's really wonderful. And I think that's characteristic of, I think that provides also, as a secondary measure, another opportunity to talk about burnout with the people that you mentor. I think often those conversations don't come in the, we're walking around with charts going from patient room to patient room. There's probably very little personal that's going to be said there, or while we're at the lab bench together, maybe not so much. But in the down times and the off times and the availability of just, being side by side with one another, I think that's when those moments can often occur that lead to conversations that maybe say, I wonder if you might be struggling with a little bit of burnout. Why don't we take a look at some things, or why don't you take this inventory and see if it's able to be helpful for you?
Great, thank you. Okay, our next question. Do you know of any workplace programs or burnout intervention tactics at the workplace that have struck you as particularly innovative or effective?
That's a really great question. Actually, I'd have to do about a little bit of research. There's a really great field of kind of organizational psychology that focuses on organization wellness too, and how to integrate that in your work environment. I think my reading has more been on the topic of kind of what individuals can do to kind of influence their realm of influence. So for, people who are running kind of their, department, or kind of, and so taking kind of that personal stock helps to change kind of their immediate culture too. But on large system scales, I know there's some great data out there about particular programs that people can use. I'm not as familiar, but I'm happy to look into that and forward to you what I find.
Okay, that would be great, and I'll make sure that we get it out to our membership. And this is a question by our Diversity and Inclusion Officer, Dr. Juanice Taylor. She said, recently a colleague referenced the 5 Ps: pandemic, panic, police brutality, protesting, and politics. What recommendations do you have to help those dealing with these feelings while navigating both personal and professional identities?
Yeah. That's really good. There are so many great acronyms. I hadn't heard all of those 5 Ps, but I do think those are especially relevant to our time today. I mean, obviously, I mentioned a lot about pandemic, but I think a lot of the social unrest is really having a significant impact both on our communities, on families, on individual trainees. So I think a couple of things have struck me as both helpful from anecdotes that I've heard from other professionals and academics. One is, that, they haven't maybe tried to, co-opt their group time to be kind of an education session, but at least being able to be open to shared grievances and saying, hey, I recognize today is really, tough. Or I read this in the headline today, about, the death of this person or that person, or this is going on in this part of the country. Didn't you say you have family from there? I think that helps to do a couple of things. It gives our trainees kind of permission to talk about the things that are hard without stigmatizing them as being, less than or being weak. I think, certainly, even when we don't intend to, our organizations all have kind of hierarchies. And so it's very rare and certainly not often encouraged to, complain up. Most people kind of complain down, or at least let people know how they're struggling. So I think one, just being genuine and open and able to be a sounding board. And sometimes that's just being a listening ear too. But I think, bringing them up, and again, not without, I don't want anyone to feel like they have to come in and be, an expert, because often none of us can be on, every one of those Ps. But to say, listen, I can hear the distress that you're feeling. I know that's real. And is there a way that I can help you with that? Or if not, having access to the diversity inclusion office, or who might be able to equip you with the resources, or at least give you the names and kind of connections to people who could help them make that next step, so that they don't feel like they're worrying alone. And I'll give you just a brief example. So, where I live in Kansas, in terms of, physician practices, there just aren't as many kind of minority, physicians. And so it's been interesting to see kind of our local medical association being a little bit more intentional about that, both in terms of mentorship and being open to discussion and dialogue. And I think that's healing for everyone, and it helps voices who otherwise wouldn't stand up and say, I'm feeling hurt in this way, to say it's okay to say that, and how can we walk together?
Okay, thank you for that. Are there any other questions? I don't think we have any more. I just want to thank everyone for attending today, and I do apologize for the technical difficulties. We did go through the slides earlier and they were working fine. So what we're going to do, we did record today's session, and when we send out the recording, we will also send out the presentation as a separate PDF so that you can listen to him and go back and see those slides that weren't completely up from the beginning. Dr. Mitnaul, thank you so much for taking the time to present to us today. We're getting a lot of comments in the public chat, just everyone saying thank you and that they absolutely loved it. I know that I learned a lot, and we're going to be able to put this into practice, because we're going to get on the other side of this. And I know that this information that you gave us today is going to help us come out better on the other side of it with these resources and this new information that we can apply to our personal lives and to our positions as leaders and mentors.